Hi, I'm Nat from PACOP, and today on PACOP Clinical Bites, we are looking at the Deteriorating Resident Tool. The Deteriorating Resident Tool, or the DRT, is part of the PACOP Profile Collection. There are three parts to the PACOP Profile Collection. There is the admission and discharge form. There is the three-part clinical assessment tool, which is done every 3 months. And as we're talking about today, there is the Deteriorating Resident Tool. The DRT is designed to be your go-to tool. If you are worried about a resident in any way, or a care worker comes to you and is worried about a resident, for example, they may say, I'm worried about Bob, he's just a bit off today, or can you have a look at Mary, she hasn't been eating her food for the last few days, or whatever it is, we say, grab the DRT, go to the resident and do the assessments on the tool. It can be done at any time. So within the profile collection, you have your three-part clinical assessment tool, which is done every 3 months. And then this DRT can be done at any time and as often as you like on any resident. It's a one-page tool. You'll see it on the screen at the moment. It is front and back, one sheet, very simple to use. You'll see that it has all the same assessments that are on your three-part clinical assessment 3-monthly form, plus a little section at the end, which is some questions to help identify whether this resident would benefit from palliative care. Once again, the beauty of this tool is that you can use it whenever you like. Sometimes when a resident is not quite right, we often don't know where to start. This is where you can start. Grab the tool, go and do the assessments, and then based on the assessments, you can make a plan. Grab the tool, assess the resident, make your plan. At the end of the form, as we mentioned before, there is a few questions, and like all our forms, it is an easy tick box format. Go through the statements and tick yes or no. When you get to the end of the questions, there is a little key to help you devise your plan. So yes to any of the questions, then this resident would likely benefit from palliative care. Now, if, for instance, you are participating in the Outcomes Collection as well as the Profile Collection, now would be the time to start an episode of palliative care in the Outcomes Collection. However, if you are simply doing the Profile Collection, proceed as you normally would when you have identified a resident is palliative with whatever processes you have in place in your aged care home. If you tick no to all of the statements, it indicates this resident does not yet have palliative care needs. So therefore we say review your current care plan to ensure you're meeting all of the residents' current needs and continue to monitor using the 3-monthly profile assessment. Once again, if you're worried about the resident again tomorrow or next week or next month and it's before the 3-monthly profile assessment is due, grab this DRT and go and use it to assess the resident and make a plan. Thanks for watching PACOP Clinical Bites. We have more information about the DRT on our website, or you can contact any of our lovely improvement facilitators at any time.